57.1%, or over half of the class, selected a 5 on a 5-point scale to represent the value they place on their own mental health. As you can see, all respondents selected a 3 or higher. But to what extent would you go to find improvement within this sector of your life? How much do you truly value your own mental health if you would choose to overlook resources which could spark potential improvement? At first, dream therapy may seem like an atypical and possibly irrelevant form of treatment, as it is rarely mentioned amongst other traditional techniques to improve one's mental health. Many people's unfamiliarity with dream therapy results in a preconceived bias of rejection. This aligns with the results found in my audience analysis. As 14 of the 14 respondents reported having never been to dream therapy, there was also a low reported likelihood of even considering this resource, which is shown on the graphs. So 0% selected yes, and 6 people selected they wouldn't even consider this resource. Before performing extensive research on dream therapy, I too overlooked the value within this treatment mechanism. The articles I will be using to persuade the value within dream therapy come from reputable sources and are written by specialized professionals. In this speech, I will be promoting dream therapy as an impactful form of mental health treatment, specifically because it elevates the effectiveness and value of communication within talk therapy. First, it is important to understand what dream therapy is so you are able to formulate a better, more educated opinion. What is dream therapy? According to Louis Lave's website, dream therapy is the process of unraveling what dreams mean in relation to our waking lives. The process of dream interpretation is symbolic and is uniquely tailored to the dreamer. The dream content is used in various ways to elevate treatment on a personal level. Dream therapy is a broad term that can be used to describe numerous treatment types which incorporate dreams into the treatment plan. Through my research, I discovered dream therapy most often refers to the inclusion of dreams in talk therapy, allowing the therapist to gain insight into a patient's mental health. In the article, Management of Post-Traumatic Nightmares, a review of pharmacologic and non-pharmacologic treatments since 2013, the authors, Scott H. Waltman et al., describe imagery rehearsal in talk therapy. The patient is asked to choose a nightmare that he or she would like to eradicate. Third, the patient changes the nightmare narrative in a way that is no longer distressing. And finally, the patient rehearses the new dream narrative during wakefulness. This method is used to target specific recurring dreams in talk therapy, while other times, therapists focus more on what the dream is communicating rather than simply eliminating it. The goal of dream therapy is simple. Louis Lave Webb writes, "The aim of dream therapy isn't necessarily to come to an unmistakable interpretation of the given dream, but to find meaning, usability, and emotional substance for the client through their dreams." Now that you have a better understanding of the basics of dream therapy, you will be able to formulate your own opinions on the value of this resource as you listen to its effectiveness. As established in my informative speech, there is extensive evidence that supports the strong connection between dream content and psychological state. Reinstating information from given articles will provide support for how dream therapy can be valuable to evaluate one's mental health. Paraphrasing the article, Mental Sleep Activity and Disturbing Dreams in the Lifespan by Serena Scarpelli et al. Anxiety and depression are connected to and more common in patients with idiopathic nightmares. If a patient mentions increased nightmares in talk therapy, it could give early signs of worsening depression or anxiety, and in turn, this could help the patient be able to be treated more effectively. Additional evidence to support how dream content can lead to increased information in therapy sessions is written by Francesca Ciclari et al. In the article, Dreams and Nightmares in Healthy Adults and in Patients with Sleep and Neurological Disorders. They state, "The emotional intensity of a waking event is one of the best predictors of incorporation into dreams. This can tell therapists during a dream therapy session which events sparked more anxiety or distressing emotions, which would then allow the therapist to target those certain waking events and enhance the effectiveness of therapy. Besides knowing the connection between dream content and psychology, researchers have dedicated their time to conducting trials focused specifically on evaluating the effectiveness of dream therapy. This is shown in the marginalization of dreams in clinical psychological practice, written by Linda Leonard and Drew Dawson. The authors review an experimental study. Clients in dream condition reported keeping fewer secrets from their therapists than those in the control group, and both clients and therapists in the dream condition gave higher working alliance ratings. Dreams can be a source of useful clinical information about clients, their issues, and progress in therapy. This study shows evidence of how effective dream therapy can be. By increasing the honesty in talk therapy, patients are able to experience increased results from their session because they have that open flow of communication with their therapist. An additional study was conducted and reviewed by Nicholas Peasant and Antonio Zadra in the article, Working with Dreams in Therapy. What do we know and what should we do? They state, clinical case reports have documented that clients' dreams can reflect clinical progress or difficulties in the therapeutic process. When combined with other clinical observations, some dreams may suggest that the client is improving or ready to stop therapy. Again, the authors reveal that including dreams in therapy sessions can allow professionals to measure the progress in one's treatment. The effectiveness of dream therapy is shown through dream content's connection to psychology and these specific experimental trials. Now that you understand dream therapy and its effectiveness, I hope you can see the extensive value within this resource. As time continues, our society is placing an increasing value on mental health. In hand, the newfound attention toward mental health requires increasing need for more resources to combat these various mental illnesses, one of which is dream therapy. Acknowledging dream therapy can amplify the progress and positive results as an outcome of talk therapy sessions. Placing a higher value on this resource can benefit you as an individual and our society as a whole, as it promotes the use of modern techniques for mental health treatment. Thank you for listening to my speech.